Yes.
Prescribe. Good afternoon, and thank you all for being with us today. Obviously, Dr. Dobbs will give us an update in just a moment on our daily COVID-19 activity, but I want to emphasize right up top this afternoon that COVID-19 is still a major priority for this administration. Please continue to take it seriously. I also want to make sure that I use this megaphone to bring attention to a very, very, very serious impending issue. I'm concerned that very few people are talking about this, and it could be a true disaster for our small businesses and their workers. There is an urgent need for our legislature to act to prevent an automatic tax increase on small businesses. If the state does not refill the unemployment trust fund and the rate stays high, the unemployment tax on small businesses will skyrocket. We could be facing as much as a 950% increase on taxes on small businesses. Let me say that again, a 950% tax increase. That is the scenario that MDES alerted the legislature to over a week ago. We had initial jobless claims came out in America earlier today, and obviously it was broken down state by state as well. Our total number of unemployed in Mississippi actually ticked up slightly in the week ending June the 6th. Right now, if you've got 50 employees, you currently pay about $1,400 under the current tax rates. If unemployment hits projections and stays there for an extended period of time, that same small business could pay more than $13,000 in calendar year 2021. You could pay half a dozen Mississippi cashiers their monthly wages with that amount of money. Instead, it would be gone in taxes, which could be avoided. This, of course, is the worst possible time to raise taxes. And since the legislature got control of the CARES Act funds, they are the only ones that can prevent a tax increase from occurring. Can you imagine raising taxes on Mississippi small businesses right now? It would be the workers and the customers and Mississippi families that will hurt. Now, understand, I know that refilling an unemployment trust fund isn't all that cool. It's not fun. There's no sugar high of headlines. It's technical, and it will not win you any praise. But we as elected officials, we're not supposed to be here for ourselves. Our job is to make decisions that protect people. MDES calculated that they need approximately $500 million to ensure that this scenario is prevented. I am frightened that the legislature is going to avoid the issue and fund other feel-good programs instead. I know that some in the legislature are very willing to do this, but I also understand that others may think it's not that much of a priority. I cannot think of a greater priority than preventing a 950% tax increase on small businesses. I believe at the end of the day that enough legislators will agree with that and will do everything they can in the coming days to make sure that replenishment of the unemployment trust fund is made a priority with CARES Act dollars. At this time, I'm going to ask Dr. Dobbs to give us an update on COVID-19. Dr. Dobbs.
Thank you, Governor. I appreciate it. So today we're reporting 381 new cases of coronavirus and sadly 5 additional deaths. I will let you know that the full report will be forthcoming later. We have some data validation issues we want to work through. We don't want to send something out that's not entirely accurate. So please anticipate that coming out before long. We did get some interesting questions about where people are counted. If, as far as the case, is it the county of residence or is it where they're tested? The standard has been forever, for every disease, it's the county of residence. And so we do report it back to the county of residence, even if it's an out-of-state county. Now, for some situations, it makes a lot of sense if you live across the border in Louisiana or Arkansas. But for others, like college students, I know it can be a little bit misleading. We did, of our total cases for the entire time, it was 681 of those were out of state. So the vast majority are going to be folks who have in-state residence, not surprisingly. This is also relevant because we recently have identified a cluster of cases and outbreaks in Oxford, Mississippi, and we've spoken with the mayor and physicians and clinicians and nurse practitioners in that community, and we do think that they're at the front end or at the mid sort of section of a significant outbreak. And what we've identified so far is that it seems to be related to community transmission and social gatherings, and we have linked some patients back, or quite a few patients back, to fraternity rush parties that are happening in the summer. And early information suggests that they're violating the law in the number of people who are at these parties. It is still in the executive order that if you're going to have an indoor gathering, and you can't social distance, it should be 20 people or less. And that is clearly not happening in these scenarios. So I just want to reiterate that it is currently the legal limit is 20 indoors or 50 if you can social distance. So please keep that in mind. There are serious health consequences. Our initial investigation of this, the people in Oxford, 81% of the new cases are between the ages of 18 and 24, consistent with college-age kids. Of those, 92% are from in-state, so 8% are out of state, and 60% are actually from Lafayette County. Now, we do have mechanisms for looking at not just the county of residence as far as the case identification goes, but also where the test was performed. So that's one of the things that we're going to be looking at and sharing that information for the college town specifically, because they have a little bit of a unique scenario. But still, the vast majority of cases we've identified so far are Mississippi residents. But obviously, we have other ways of looking at information. If we also look at other measures, very concerned that we're seeing an increase in COVID-like illness and pneumonia in our surveillance data. We do have a syndromic surveillance system that basically looks at a lot of different clinics and hospitals around the state. And for the first time, since we really started looking at this from the coronavirus outbreak, we're seeing a significant upturn. And that's usually a pretty worrisome indicator. So please, coronavirus is out there. My head is sore from banging it on the wall. Wear a mask, social distance. Don't do mass gatherings, and certainly follow the rules. You don't want me to see me with a bruise up here next time. Other questions we've had, someone asked about how many cases have we identified from serology, and we have identified 125 cases from serology. The rest of them have, who are identified from serology. The rest of them are going to be from the PCR nasal swab. That was a question someone had mentioned. Other issues as far as the health system, we continue to see significant stress on the healthcare system, 465 inpatients, 159 ICU, and 100 on the mechanical ventilator. We still not only see ongoing pressure on the health system, but I'm increasingly getting notified from doctors across the state that they're not able to get patients to care within their hospital, and they're being stressed to transfer them, especially to places that are not their normal transfer locations. This is something we're following very closely, and it's something that may need additional efforts in the near future. Again, everything's related, ongoing case burden. Now we're seeing this younger generation of cases coming through the system, and inevitably, it's going to work its way up the system, and then the parents, because we're already seeing parents who've got it from their kids around this Oxford situation, and then it's going to go to the grandparents, and we're going to have more severe illness and hospitalizations and deaths. It's just the way this thing works. So please, everyone, follow the rules and be careful. The things that we can do to prevent transmission are so very easy. Thank you, Governor.
Thank you, Dr. Dobbs. I do want to, again, reiterate to everyone the importance of this. We have said from the beginning that our goal is to ensure that every single Mississippian that can get better with quality care receives that quality care. And so when Dr. Dobbs talks about the additional stress in our healthcare system, when we talk about the number of ventilators currently in use at approximately 100, We know that stayed between 60 and 80 for weeks and weeks on end. We are continuing to see slow but steady increases in those numbers, and that concerns us. That combined with the fact that the elective surgeries and other things are going on at the hospitals, the combination is putting stress, particularly in specific markets. The decisions that we have to make are going to be made based upon the desire to ensure, again, that healthcare capacity is available for anyone who needs it. And so that is what's going to drive our decision making. It has from the beginning, and it will continue to do so. But I just want the people to understand that there are stresses on the healthcare system, which is going to make us continue to have uncomfortable conversations about what we can do to make it more likely that we protect that healthcare system in the near future. An additional ask that has been made of the Mississippi legislature as it relates to the CARES Act funds is, of course, the amount of money that the Mississippi Emergency Management Agency will be requesting to ensure not only that we can pay expenses that have already been incurred, but recognizing that we are not done with COVID-19. The CARES Act was originally passed by the Congress so as to spend money on things that otherwise were not budgeted for and would not have been needed were it not for the worst pandemic in over 100 years in this country. There has been an immense amount of money spent by the Mississippi Emergency Management Agency, and we need the Mississippi legislature to act in the coming days to provide as much as $230 million for the Mississippi Emergency Management Agency. And I'll turn it over to the director and let him talk through that. Director?
Thank you, Governor. Good afternoon, everyone. Just a quick update with regard to PPE. In the last couple of days, I know we're a little off this week on last time I reported to you. Last 2 days alone, we have delivered 90 to 91 Tier 1 facilities across the state. All 82 county point of distribution locations will have been serviced by the end of business day today, to include the Mississippi Band of Choctaw Indians. I make those numbers just to show you that we are still delivering a lot of PPE out to our facilities. And as the number of facilities in our cases grow and positive cases are identified, the demand on PPE, even though it has lessened some, we are still pushing a lot of PPE out. We have been stockpiling amounts of PPE to get ready for what we anticipate to be a resurgence in the fall. That is a delicate process as we continue to push PPE out. We're also having to make sure that our stockpiles are adequate to sustain should we see a surge that we anticipate in the fall. Warehouse space has been a challenge as we bring that in. We have been able to facilitate that as we move it around a number of different locations. As you can imagine, 21-day supply of Tier 1 and Tier 3 PPE, it's a lot. So we continue to work that and manage that as we move forward. Just a quick update on our declaration process with Tropical Storm Cristobal. We have determined that the damages do in fact justify requesting from FEMA joint damage assessments. We'll be doing that. I know that in Harrison County they've already started beach cleanup and debris removal there. That has been a monumental effort to get the debris off the beaches, and all of the animals that included that as well. And then we're working in canals on cleaning debris, not only in Harrison, but Hancock and Jackson County as well. The Easter tornado on April the 12th, just a reminder for the 26 counties that we added back for the public assistance declaration, you have until June the 28th to make your final application process for damages there, June the 28th. So make sure that you pay attention to those timelines for those 26 counties specifically that we added back to that for the Easter tornado damage. Still waiting on FEMA's answer back on the April 22nd, 23rd storm. There are about 11 other states that are waiting on FEMA determinations, and we are in the queue with them about halfway down. Just a quick update. I know that Mr. McCraney gave you an update on the backwater flood. I know that we've certainly been occupied with other things, but that backwater event is still there. As of April the 23rd, the backwater crested at just above 96 feet. Over 500,000 acres were flooded at that time. As of yesterday, the figures that we got, the backwater has now gotten to about 90 feet, so about a 6-foot drop. The steel bayou gates were actually finally opened on Saturday, so we're seeing the water start to push out and run back out into the Yazoo Basin. Currently, about 278,000 acres still remain flooded. To date, the backwater flood event from last year is the longest disaster period in FEMA history, just to bring everybody's attention to that, and that backwater is still flooded today. Governor, that's all I have on my updates today, sir.
Thank you, Director. Appreciate all that you are doing very, very much. Courtney Ann?
Governor, yesterday you tweeted about how you were concerned that folks were losing interest, and if people could be on guard, small efforts make a big difference. Yesterday you were at the deputy's funeral. From our video, you can see that you were very close to the family. You weren't wearing a mask. They weren't wearing masks. What do you say about leading, not at least here, leading by example? And Dr. Dobbs, you talked about your frustrations. What's your reaction to that?
What I would tell you is that at the funeral of this law enforcement officer yesterday, I made a decision to attend the burial. I did so. I tried very hard to socially distance. The fact of the matter is, given what's going on in this country today, I think it's real important for our leaders to stand up for our men and women who put on the uniform and protect us every day. This gentleman was gunned down in the line of duty, and I believe it is part of my job, and it's a part of my job that I respect and honor and will always do, to go and pay my respects to this individual and his family. This one was particularly close to home, as I grew up in Florence in South Rankin County. This deputy lived in North Simpson County, and Sheriff Mullins is a personal friend of mine. Sheriff Bailey in Rankin County is a personal friend of mine. They have known this gentleman, worked with him for years and years and years, and so the emotions were very, very high. I did have a mask. It was in my pocket. I should have put it on. The fact of the matter is, if y'all want to shame me for the way in which I handled it, go for it. That's part of your job. But I will not apologize for attending this funeral for this slain law enforcement officer.
I guess we're
Yes, sir.
asking because you've not had it on in other public events as well.
I have worn my mask. I actually went to the Capitol earlier today. I wore a mask in the Capitol. I am concerned about what's going on in that particular setting. But the fact is, some of us are in jobs in which we have to take additional risk. It's not perfect. It's not an ideal scenario, but it is what it is. Yes, sir.
Governor, Dr. Dobbs also talked about the fact that if you're at a large gathering like a funeral, if you can't social distance, it should be 20 or less. There were much more than 20 people at that funeral yesterday.
There were more than 20 people at the funeral yesterday. In fact, I know there were thousands and thousands of Mississippians that were paying their respects to this law enforcement officer who lost his life in the line of duty. I will not apologize for me attending it. I'm always, as long as I'm governor of this state, I will be attending funerals of those who lose their life because they simply got up and put on the uniform that day.
Can I ask a follow-up?
Absolutely.
A lot of people are concerned that because most of the people dying from the coronavirus are African Americans, that a lot of white people don't think they're at risk and they're not wearing a mask. There are Republicans in the legislature. Democrats look at them as if they're from another planet because they say Republicans in the Senate and House are not wearing masks. That there's an issue of, it's a black and white issue, some people perceive.
Well, I'm here to tell you, and I'll let Dr. Dobbs speak to this as well, but I'm here to tell you that everybody in Mississippi is at risk. The coronavirus obviously has been particularly cruel to those in our African American community in Mississippi, but the fact of the matter is that the virus is certainly risky to every single Mississippian in terms of one's ability to contract it. The fact of the matter is that it is more risky in terms of death and other things if you fit into one of those vulnerable categories, if you're 60 years or older, if you have pre-existing conditions, if you have hypertension, if you have heart challenges, if you have a hard time breathing, if you are overweight. There are certainly those that have higher risk, but the fact of the matter is it ain't a Democrat or a Republican thing. Everybody in Mississippi is at risk.
Yeah, you know, we have seen a little bit of a dichotomy. And first off, I would like to applaud our African American community who's embraced social distancing and masking a lot more. We're still struggling with our younger African American folks, but it's an issue of youth, and certainly understand that. We'll be addressing that through social media and other marketing mechanisms. Social distancing and masks is for everyone. There's a great article in the Wall Street Journal today talking about the simple things we can do to prevent transmission, what we learned. It's basically social distancing, masks, and mass gatherings. And if we can, I kid you not, if we could just do those things, a lot of the predictions are that coronavirus would just wither away. But we just don't have the patience, unfortunately, to do the easiest things. It's absolutely maddening. So it's for everybody. The kids in Oxford were almost all white kids, and their families who were affected are white kids in the nursing home. It killed more white folks than black folks. I mean, it's not a race thing. It's an everybody thing, and we all got to do what we got to do to protect ourselves and be selfless enough to do this stuff to protect others.
Yes, sir.
Governor, let me reject the notion that you said that it's our job to shame you. It's not. We wanted to know, well, I want to know, and viewers want to know, why should they have to wear a mask if you don't wear a mask?
Actually, you didn't hear what I said. What I said
You said it was our job to shame you.
No, I said if you choose to shame me, you're more than welcome to do so.
You didn't say that.
If y'all want to do that, you're more than welcome to do so. What I am telling you is everyone has a sense of personal responsibility. It is important that everybody in Mississippi do what they believe is right to take care of themselves and to take care of their neighbors and to take care of their friends. The fact of the matter is, I have a job to do. I was elected to be the governor of this state, and in doing so, there are certain things that I not only have to do, but that I want to do. And I am going to pay respect to any officer that loses his life in the line of duty. And if that means I have to put myself at personal risk to do so, then so be it. Now, I do think it's important that you wear a mask when you're in public, particularly in large gatherings, in small indoor confined spaces. I agree completely with what Dr. Dobbs has been recommending and suggesting, and I will tell you that I have tried, and Ely has tried, and my kids have tried when they are in settings to wear a mask. Yes.
Dave Elliott with WLOX has a question.
Great.
Thank you, Renee. Governor, I'm looking for a little clarity here. You can plead all you want, but regarding bars, restaurants, stores, parks, you name it, do you consider your executive orders merely suggestions, or are they enforceable rules? In other words, let's say businesses are clearly ignoring gathering and distancing guidelines. Does someone, sheriff's departments, police departments, mayors, supervisors, have the authority and even the responsibility to monitor, perhaps crack down?
Executive orders, the words on the page do have the full effect and force of law in the state of Mississippi. And just like every other a law of the land of the state, it is a combined effort by local and state law enforcement officers to enforce those laws. And those executive orders are no different.
Hunter Dawkins with the Gazebo Gazette has a question.
Hey, Renee, thank you very much. Governor, thank you very much. I appreciate it. As you know, as I've talked to you about, Governor, the last two press conferences about the House Bill H-27 that is going to change the DMR regulatory matters. It is apparently passed. It should be headed to your desk sometime soon. Can you give me a kind of the idea of what you're going to overlook on the bill, and if there are going to be any changes that you would like or not?
Well, thank you, Hunter. You have mentioned that, of course, a couple times at our previous press conferences this week, and I appreciate that. I did not know that it was headed to my desk. I will tell you that I've got a bill that was due today. There are 21 bills that are due on Monday and approximately that many on Tuesday. I have personally started looking at the 21 bills that are due on Monday. One of the challenges that we find with the legislature making the decision to stay in session here late until late into June and not sine dying is there's a difference in the amount of time that the governor has to review bills when they are in session versus when they are not in session. And so we only have 5 days to review the bills that they are sending us. I have not looked at that particular bill at this time. I will definitely do so before it is due. That will be 5 days after we actually get it, not counting Sunday. And so I don't know exactly what that day is, but because the number of bills are stacking up, we'll be working hard through the night over the next week or so to look at that bill and any other ones that the legislature sends us.
Taylor Vance with Daily Journal has a question.
Thank you, Renee. Governor Reeves, earlier today, the Senate Education Committee voted to table one of your nominees to the State Board of Education, and several members of that committee have essentially told me that nomination is dead, and they don't plan to take it up again. And that was as you're well aware, former State Senator Nancy Collins. And so I was just curious what your response is to that vote.
Yes, I was told after the vote that had occurred. What I would tell you is there are an awful lot of Republican senators that have been concerned about the amount of influence that Democrats have in the Mississippi Senate right now, and particularly on education issues. There's no doubt that the Democrats made a motion to kill the appointment of former Senator Nancy Collins, and her only sin was being a conservative. She was defeated because she was a conservative, and evidently there are a lot of Democrats that have decided that they don't want any conservatives on the State Board of Education. That's unfortunate, and what's even more unfortunate is some of the Republicans on the committee allowed it to happen. Yes.
Sarah Ulmer with Real Politics has a question. Sarah?
Hey, Governor. There's been a lot of talk up here at the Capitol, obviously, about the state flag. You've been very clear about your position on the issue, that you think that it should go to the vote of the people. I was curious, would you be open to a solution where the legislature votes another flag design as official in some way to combine with our existing flag, where entities could choose to fly one of both of them as a legal state flag?
Well, thank you for that question. I'm open to conversations around any solution. Obviously, businesses today have the right to fly any flag they choose to fly, and evidently, based upon some of the actions over the last several weeks and months, there have been some local governments that believe they have the authority to do that as well. And so I think that's one potential conversation. I know, for instance, that former Representative Greg Snowden actually filed legislation for a number of years in a row because he talked to me about it, about the possibility of actually having two official state flags in statute. Now, that didn't go anywhere in the House and ultimately never came over to the Senate when I was Lieutenant Governor. But I think what I would tell you is that I'm certainly open to having any conversations, but I believe very strongly that if we're going to change the flag, the people of Mississippi should be the ones who make that decision.
Nick June with Jackson Free Press has a question. Nick?
Hi there. Thank you. I recently spoke to Dr. Neville Kelly, who heads infection control at UNMC. She warned that with COVID-19 hospitalizations at present levels, a heavy flu season, the kind we've seen in recent years, could overwhelm the healthcare system. Now that COVID-19 is appearing not to recede with the summer, are we concerned that maintaining this plateau is untenable if it continues into the winter? That's for Dr. Dobbs. For Governor Reeves, would you consider issuing an executive order mandating the use of masks, not closing down businesses or chewing curfews, just requiring masks? And I will have one quick follow-up. Thank you.
Thank you.
Yes, we are extremely concerned about going into the fall. The summer's been worse than we had anticipated in large measure because the anticipated adherence with social distancing has been overwhelmingly disappointing, and that's certainly driving community transmission. And so instead of decreasing through the summer and giving us a chance to regroup and build up, we're having to chase down a lot more stuff than we had anticipated. So yeah, we're really, really worried about it. Now, we do have a lot of efforts going to try to prepare for a surge of cases in the fall, which seems quite likely. There are tried and true mechanisms that we know that we can use to depopulate, hospitals to prepare for other types of patients. But there's no amount of preparation that can prepare for a tidal wave of cases. It's like mopping up the floor, but you won't turn the sink off. So we got to turn the sink off if we want to clean up the floor. So we're going to prepare in every way we can, and our objective is to make sure that everybody who needs a ventilator can get one. But the scenario is very possible that someone's going to have a heart attack, and they're going to show up at a hospital, and there's not going to be a ventilator because all the ventilators are taken. I get calls all the time from hospitals that are having to do extraordinary things that they've never had to do before. And this is the summer. This is the slow time, right? So my staff asked me for vacation time, and I was like, no, and maybe in a year. 2021, I told my staff spring of 21 they can maybe have a vacation.
Will you let me have one then too? Yes, sir. Renee.
Hi, yeah, so real quick, for Governor Reeves, will you issue an executive order mandating the use of masks? And then I'll have the follow-up for Dr. Dobbs very briefly.
We have issued executive orders that mandated the wearing of masks in specific counties. We've done it intermittently over several weeks in 9 different counties. If it becomes necessary to do so, I would not take that option off the table.
Thank you. For Dr. Dobbs, there have been a number of delays with the MSDH information system in recent weeks. Are these problems likely to continue, and are they likely to worsen?
We're going to continue to struggle with a legacy software system. A lot of the public health infrastructure has been weakened over our country over the past couple decades, and so we're having to use a system that was not designed for this purpose. We're in the process of looking at alternatives to make sure that when we get into this, again, this is the slow time, so this is our time to prepare. And so we continue to have our staff working until 3 in the morning sometimes trying to get the numbers out. Last night was one of those. It may be periodic issues, but just rest assured that we're working toward more permanent solutions in the near future, and that my team is committed to getting y'all the right data as quickly as possible.
You said something earlier about cities like Gulfport, which took down the state flag this week. Did you say they may be breaking the law? Are they required to follow, to fly the state flag under state law?
I didn't say that. I said that they evidently have the right to do that, or they're certainly doing it. So as far as I know, I'm not their city attorney, but as far as I know, they can choose not to, I presume.
Dr. Dobbs, today the Safe Start Task Force, Governor, you could weigh in as well perhaps. You're talking about this concern for the resurgence in the fall. College campuses, they're planning to go back in the fall. I know that they released their kind of baseline guidelines of what they'd like to see the public universities do today. It's pretty basic in terms of social distancing and things like that, but given dorm situations, just kind of the logistics of it as they exist, are you guys concerned about what that will look like with students back on all those campuses?
Just for K-12, our community colleges and our higher institutions, we do feel comfortable from the public health community in Mississippi especially that we can educate kids pretty safely. In classrooms, in controlled environments, there's always going to be some risk, but it can be minimized. It's the other things that are going to kill us. It's the extracurricular activities, it's the sporting events, it's the fraternity parties and social events. That's going to be our challenge. So we're working with all of them and try to help provide some guidance. But as we've seen, this is the summer, and we can't even stop fraternity parties in the summer. So I'm gravely concerned.
I'll just say yes to the question. Are you concerned? Anything you say after that, the answer is yes.
They had mentioned, I think, that the IHL action may be that they would need, I think they used the words massive testing for the campuses, help from the Department of Health for that. I know that some of them have talked about trying to help you guys with contact tracing, but logistically and staff-wise, is there a concern for the resources that would be needed with that many folks back on campuses?
We have been talking with them about assistance with contact tracing when cases occur. And certainly they know their folks, their student health centers, and they've been great. We're still continuing those conversations. Testing's not a panacea. You can't stop an epidemic with testing, right? You're always looking backwards, and it has a role. And certainly I think testing has a role. There's no doubt about it. Depending on the degree of testing, it's not a mission that the Department of Health Resources can do. It's something that would certainly require the investment of individuals, like insurance and all that kind of stuff, and the medical community in general. So testing's good. You can't test your way out of it. You got to prevent transmission, and I think that's a fallacy that too many folks have bought into. Testing, prevention, contact tracing, and then eventually vaccine and better treatment are all a piece of it. But if we try to depend on one piece, we're going to fail miserably.
Patrick McGee with Harold has a question.
Yes, Dr. Dobbs, Harrison County has seen a steady increase in patients in recent days and weeks, and I was curious if y'all been to determine any reason behind that increase.
Which county? I'm sorry.
Harrison
County. It looks like it's community transmission like everywhere else. We haven't. I'll go back and look at it, but just looking broadly, everything we've been seeing across the state. When we've been following these, we have a county profile we'll look at, and we'll break it down. Is it an outbreak? Is it like healthcare associated? Is it corrections? Is it some other sort of outbreak? Or is it just people who got it in the community unassociated with an outbreak? And right now, it's overwhelmingly people just being out the community, sorry about that, and getting it. So that's what's happening. If you go to the beaches and if you go to the bars, and if you tell me what you see, and you see people talking right in front of each other, and if it's loud, and you're in a condition where you're having to talk loudly because you want to communicate, and you're right in somebody's face, and you're indoors, that is the perfect way to spread coronavirus.
Clay Morris with Mississippi Free Press has a question.
Thank you. So on June 9th, the Mississippi Department of Education released their considerations for schools, but within those considerations, there were no direct health safety precautions, although other states like North Carolina have extensive lists about masks and reducing the risk in schools in K through 12. So I'm curious, Dr. Dobbs and Governor Reeves, if there are any health safety precautions in process for K through 12.
We're working closely with the Department of Education, and then we have an upcoming all superintendents call, helping them with guidance on what to do when cases and outbreaks occur within education settings, and also with decision tools and mitigation steps they can do for each activity. From our conversations, each district will construct their own reopening plan based on their resources and local situation. We are going to try to make sure that they have the other resources they need for safety decisions and risk mitigation, including masks, social distancing, hand hygiene, and frankly deciding which activities are acceptable and which ones are not, and which ones can be delayed.
Dr. Dobbs, are you comfortable with no clear guidance or clear leadership on the mask wearing issue, or whether or not people should wear masks if they're looking and seeing some of their representatives not wearing masks, some of their mayors not wearing masks, some of the governor not wearing a mask at times? Are you comfortable with that?
Yeah, it's becoming more and more understood from a scientific perspective what the real benefits are. And the surgical mask like you're wearing is going to be really, really great. It has actually some charged particles within it that'll actually trap viruses. So we know how important it is. And, so the consensus is there that the masks are a critical element. And so I would strongly encourage everyone at all levels to wear masks in public, especially in situations where you're going to be around someone for more than, so to be a contact, you're with someone for a period of time and you're within 6 feet without a mask. And, sometimes you don't meet that standard, but if we had, local leadership's going to be really important. And I think in some of our local communities, if you look at what happened like in Scott and Leake County, where they were the worst that we've had, and sometimes they've had some little bounces, but they coalesced as a community around the things they could do to protect their community. And so I would like to implore, especially local leaders, to embrace the simple things they can do to protect their community, because in Mississippi, it's all about the local. And if we can really get folks to embrace it, not only local, but local businesses and local churches and everybody, we'll be in such better shape.
Governor, the state auditor today released an audit that shows the Office of Dropout Prevention was defunct, had changed graduation rates, calculated to improve the statistics. Question there, what are your thoughts on that investigation if you've had the time to see it? And do you think that the board and or Dr. Wright should face penalties as a result of that?
It's the first I've heard of it. I'm sorry. I'll go back and take a look at it. I didn't know anything about it. Ross.
Governor, you were talking earlier about the question of large gatherings at businesses like restaurants. I noticed a lot of popular restaurants, particularly in Rankin County, the parking lots were filled the last couple of days. Should the Rankin County sheriff deputies be telling these businesses that they have to reduce their business clientele to 50%? How should they manage that? Again, if it seems to be the perception that a lot of folks have forgotten all about the rules and want to just go back to normal, to the old normal.
Yeah, well, look, there's no doubt that there are a lot of people that want to go back to the old normal. And as I look back over the last 3 or 4 or 5 weeks, I mean, there's no question that the coronavirus and COVID-19 was the only thing being discussed until the protests around the country started happening. And when that started happening, the cable news networks and lots of other online discussions, et cetera, completely moved away from the coronavirus as if it didn't even exist. And so I think the reality is that that coronavirus is in all of our communities. It is something that we have to continue to work with. And look, we had our first case on March the 11th. Today, I believe, is June the 18th. So we're well into and well near 100 days of dealing with the coronavirus, not to mention the weeks and weeks and weeks before March the 11th that we were actually planning and looking towards putting plans in place. And so it has to be a joint effort. There has to be local law enforcement helping enforce the ordinances. But at the end of the day, the most important thing that can occur is for everyone to recognize that coronavirus is still in our communities and to do what we can to minimize and mitigate the risk.
Erica Hensley with Mississippi Today has a question.
Thanks, Renee. Question for Dr. Dobbs. Following up on the Ole Miss student cases and contact tracing at universities, I understand that those cases weren't linked to Lafayette because they're not technically their county of residence, but Ole Miss and Mayor Tannehill said this week that they weren't contacted by y'all about this particular cluster at all, and that the mayor found the additional cases by contacting local clinics. So even if some students slip through the county of residency tracking, wouldn't contact tracing and case investigations have sort of pinpointed them to Oxford between that 2-week window, and then that information would have trickled down to the university and the mayor that way?
So there's a lot in there, and I'll explain a little bit what's going on. The clinics knew it before we did, and they always will. And the notification actually got to the mayor before it got to us. So, so I would like to remind our physicians and nurse practitioners out there that if you see an outbreak, it is a reportable condition, so please call the Department of Health so that we can intervene. So we didn't have as much awareness as she did at the moment, to be quite honest. The other thing is these are not students actively. They're people who live in Oxford who are not engaged in class by and large. So that's a little bit different scenario. So when we do maintain close communications with student health, but these weren't people who were actively engaged in school. I've learned a lot about the summer life in Oxford. Apparently it's a lot of fun, but I do implore the young folks in Oxford, to please demonstrate a modicum of restraint, because we're all going to pay for it if you don't.
Governor, just for the record, back to the shame part, you said the fact of the matter is if y'all want to shame me for the way I handle it, go for it. That's part of your job, but I will not apologize for attending the funeral. So I just wanted to make sure it was on the record. But also, is there any specific measures that could be put in place in the meantime, because we're expecting stress on the hospitals if we have a high flu season combined with coronavirus, that could encourage small businesses to put in something you're very concerned about, put in additional protective measures, including screens, increase PPE for customers and employees that can be utilized before we hit the winter months when temperatures start to cool.
Yeah, I think there are certainly measures that we can put in place. There are measures that we will continue to discuss and talk about. There's no question that there are certainly options out there. We currently, as you know, we had additional measures in place in 9 different counties over the last 6 weeks because there were particularly high numbers there. But what I will tell you is, as I look at where we find ourselves, and particularly the healthcare system, the healthcare system in our state right now is slightly more stressed from COVID-19 than it has been in the last 6 to 8 weeks. But it's only slightly more stressed. We're talking about 75, 80 people on vents to 100 people on vents. There's only 20 additional folks with COVID-19 in hospitals across the state on ventilators. The stress of the system is in large part due to all of the elective surgeries that are now going on that were not going on in March and April. And so those are things that we've got to consider as we look at going into the fall, all of the different levers that we can pull to protect the integrity of the system. In terms of encouraging additional efforts and measures in terms of wearing masks, et cetera, those are all on the table as we move through the summer months and into the fall.
Jennifer Kay with Bloomberg Law has a question.
Hi, thank you. Governor, I'd like to ask about one of the bills that may be in the stack of bills you were describing a few moments ago. Lawmakers have sent you HB 1243, defining penalties for trespassing or impeding critical infrastructure. Do you intend to sign this bill, and how would you respond to environmental advocates who criticize these kinds of bills for limiting demonstrations near oil and gas pipelines or other infrastructure?
Thank you for that question. I have not read that particular bill. It is currently in the process of going through my policy team, my legal team, and my executive staff. They will each take a look at that bill, make a recommendation, and I'll determine sometime within 5 days of receiving it if we're going to sign it or not.
Dave with WLOX has another question.
Yeah, Governor, in the national news, ABC was here, the New York Times, everyone's been writing articles about these Confederate monuments and statues. It's under the glare of the spotlight. We have a big protest planned down here on the coast, coming up on Friday over at the Harrison County Courthouse. I know there's a statue in Hattiesburg that is under fire all over the state. What are your views on either protection of or consideration of removing some of these statues?
Obviously, it's a very hot topic around the country right now. There is a movement afoot to tear down statues of those who participated during the Civil War, but there's also a movement afoot, it appears, to take down statues of folks dating all the way back to the American Revolution. And I will just tell you that I think that in our state at least, and I think it's true around the country, we have a very complicated past, but it's also important that we understand our history and that we certainly not celebrate it, but we make sure that we understand it so as to not repeat the bad parts of our history. I don't believe that taking down monuments is going to change anything that's happened in our past, and I much prefer to look towards a bright future where all Mississippians can work together to grow our economy, to continue to make Mississippi an even better place to raise a family.
Governor, I assume you heard the comments of the Lowndes County Board of Supervisors President Harry Sanders, basically defending slavery after the board voted not to remove the Confederate Monument in downtown Columbus. Do you think, as the state GOP said, do you think Mr. Sanders should resign from the board?
What I would tell you is he does not speak for me. He does not speak for the Republican Party. I thought his comments were wrong. I thought they were dead wrong. And so he definitely doesn't speak to me. I'm not going to get into who ought to resign and who ought to stay. That's between him and his constituents. But what he said was wrong and does not reflect my views.
But he's a member of the Republican Party,
That's, as far as I know, that is correct.
so he represents the Republican Party in Lowndes County.
He represents one supervisor's district in Lowndes County. He does not, what he said does not reflect the views of the Mississippi Republican Party.
Kobe Vance with MPB has a question.
Yes, for Governor Reeves, Chisholm Strategies has a poll on how Mississippians are fairly split on the flag issue. And you voiced your personal opinions on ballot initiatives while in elective office, as recent as on Initiative 42. As a member of the electorate, would you vote to change the flag?
Well, Kobe, thank you for that question. I think the way I would answer the question is the firm that you mentioned was the pollster for Jim Hood in the 2019 governor's election. If any numbers they put out were anything other than garbage, I wouldn't be sitting up here talking to you. He would be, as they had projected and predicted that he would be the winner throughout 2019. And so I don't know what their polling data may or may not suggest. I don't really care what their polling data suggests. What I will tell you is I have made a commitment to the voters of Mississippi that if and when Mississippians decide that we want to change the flag, and I think at some point we will, that it ought to be done by a vote of the people, not by a backroom deal by politicians in Jackson. I have probably said that somewhere in the neighborhood of 1,000 times in the last 2 years, and I just believe firmly that if I were to change my position on that, if the people couldn't trust me on that, then what could they trust me on? And so that's my position and has been, and it's been consistent. Yes.
Sarah with Y'all Politics has another question.
Thanks, Renee. Thanks, Governor. There is a resolution that passed the chambers that would change how current state statute elects a governor or a statewide official in the event that those positions did not receive over 51% of the vote in the general election. I was just curious if you had any thoughts or comments on their move to change that going forward.
Yeah, my understanding is that's a resolution to put that on the ballot, to put that decision on the ballot to see if the people of Mississippi would like to change it. That was much discussed, and lawsuits were filed by the Democrats during the 2019 gubernatorial election. And so I haven't spent a lot of time thinking about it. What I said during the election in 2019 is I knew what the rules were when I qualified to run for governor, and I was prepared to not only win a majority of the popular vote, I was prepared to win a majority of the House districts. And lo and behold, that's exactly what we did. We won well over 50% of the popular vote in the state, and we won well over 50% of the House districts. That's the rules of the game in Mississippi. If the people of our state want to change the rules, then whenever we have another election, I'll adhere to the rules, whatever the people decide they are.
Nick from Jackson Free Press has another question.
Hi, yes, Dr. Dobbs, sorry to return to coronavirus. You say that you were very concerned about the potential for spikes, not only of coronavirus, but of the flu into the fall and winter. What I want to know is, do we have a roadmap for how many cases, how much hospitalization would represent a dire threat? Would we start shutting down things in advance of these things happening, or would we wait for things to start getting really dire? What I'm saying is can MSDH release a plan for what we want the numbers to look like moving into the future?
There are numerous strategies that we would want to deploy. One of the obvious ones would be to expand capacity, and every hospital has an expansion plan that on paper looks really good, and it basically looks like we could double our ICU capacity. But we have, we need to validate that that's really an executable plan. So that's our next sort of thing to do, is to is to make sure that not only do they have a theoretical response, but we can actually activate it, because there's a good chance we would have to activate it in the near future, at least part of it. So if you look at our available expansion of ICU beds, like using post-op recovery and anesthesia vents and that sort of thing, we do have pretty good capacity, but making that operationalized is a big deal. The other thing is, we know if we do limit some of the elective procedures, that's a way to limit hospitalizations, and that's something we could do, and we would certainly do it before we had gotten to dire situations like we did before. It was very effective previously, along with people's reluctance to engage healthcare. That's also very economically damaging to the health system, so that's something that certainly we know we don't want to destabilize our healthcare infrastructure with that component. And then also having a system of care such that you can move patients where they need to go. And that's another thing that we're working on, similar to the trauma system. So multiple strategies. We'll continue to work aggressively on them to really fine-tune it. We've got a lot of work to do, though.
Yeah, and I'd just like to follow up on something Dr. Dobbs said, which I think is really important, and that is the fact that when you shut down elective procedures in our hospitals, it is economically damaging to them. There is no doubt that they went from near full capacity down to, in some cases, 40 and 50% full capacity, and some of the procedures, those elective procedures tend to be some of the more profitable procedures that they do, and profit obviously is a relative term, but some of the highest cash flow scenario. And so no decision that we make comes without risk and comes without effects. I would point out that through the CARES Act, our hospitals in Mississippi have received somewhere between $600 and $700 million in direct federal help, which is in place specifically to help offset some of those revenue losses that the hospitals found themselves due to obviously government action shutting down some of those procedures.
Taylor with Daily Journal has another question.
Yes, Governor Reeves, I just wanted to follow up to Kobe's previous question. Regardless of who conducted the poll about the state flag, the second part of his question was, if this topic were put to a ballot initiative again, would you personally vote to change the flag, or would you vote to keep it the same? I'm just, what is your answer to that?
Well, that's a hypothetical that I cannot answer, and the reason I cannot answer it is because, for instance, in 2001, there was a vote that occurred, and in that particular question, the way in which they asked it, they said, would you like to keep our current flag, or would you like to change it to this new design as designed by some third-party commission? And I don't even remember exactly what that design was, but because of that, what could be decided, this could be put on the ballot in such a way, which was a straight up or down vote on the existing flag. We could vote to have 2 flags, as was mentioned earlier. We could vote to have 0 flags in our state. And I think it wouldn't do anyone any good for me to speculate on how I may vote when I don't even know what the actual question may be.
Hunter with the Gazebo Gazette has another question.
Thank you, Renee. Thank you, Governor. One last question for you, Governor. And this would be about the current beaches, and I'm not necessarily sure if this might be somewhat of a hike in the recent influx of the Harrison County and Hancock County coronavirus coming out. But the beaches have been closed by the supervisors from both boards since it right after Cristobal, yet there's been quite a number of people coming to the beaches regardless of the damages that could be done. And from what I've heard, some of the law enforcement that are responsible for trying to keep there does not have as much enforcement capability. My question to you, Governor, would be, is there any help that you could provide these members of law enforcement if they need, or if they contacted you to help, stop the influx on the beaches right now?
Right. I'm not trying to stop the influx onto beaches. Our executive order allows individuals to be on the beach as long as they are in groups of in small groups, as long as they utilize social distancing, et cetera. But I have made it clear from the beginning of this that there are state law enforcement assets that could be put in place to help augment what's going on by the local sheriff's office, the local city police departments, et cetera. I will tell you that I have pretty regularly been in contact with the three sheriff's offices at a minimum in the three coastal counties, and they have not requested that. If they want to request it, we'll certainly be there to help them. By the way, you've got three fantastic sheriffs in Hancock, Harrison, and Jackson counties, all three great friends of mine. And I would do anything I could to help support them, whether COVID-19 was here or not, but I'd particularly do it during COVID-19.
Nick with Jackson Free Press has another question.
Hi, Governor Reeves. I want to just remove all hypotheticals from the situation. Do you, Tate Reeves, the Mississippian, want a Mississippi flag with Confederate imagery on it, or do you want something else?
Nick, I've answered this question at least 50 times. Thank you for continuing to ask it. Thank you for your persistence. Keep going. Appreciate you joining us today. Emily?
Emily?
Hi, Governor. You have not answered this question, actually. I've asked it a few ways. Other reporters have asked it a few ways. Will you vote to keep the Confederate image on the flag? You as a person, I'm not asking as the governor, if you're the voter in the voting booth, will you vote to keep that Confederate image on the flag?
Emily, thanks again for the question. As I have said repeatedly, until we actually have a vote of the people, and that can only occur in a number of different ways. Number one, it can occur by the Mississippi legislature passing a resolution to put the vote on the ballot box, either at the next election or at any time of their choosing. There is a resolution, as I appreciate it, that has been filed in the Senate to do that. It has been referred to committee. If and when that particular committee acts, it will then go to the floor. If they choose to then send it to the House, then they can deal with it. In addition to that, there's another way that this could be voted on and put on the ballot, and that is by those who want to change the flag by receiving approximately 106,000 signatures from people all across the state of Mississippi. So every Mississippian that really wants to change the flag, they have the right to take it upon themselves to go out and do the work and put it on the ballot. It is certainly their prerogative to do so. And so those are the only two ways that it can actually be put on the ballot. And if and when it is, I will determine exactly what the question is that's on the ballot, and I'll decide how I'm going to vote. And at that time, I'll tell you how I'm going to vote. And quite frankly, I'll probably work very, very hard to see that the position is done in such a way that once all of this is over, once a vote takes place, that we can all come back together as Mississippians to fight for a better life for all of our state. Seeing no more questions, thank you very much. Please remember that, as I mentioned earlier, I know it wasn't a very popular topic amongst the press today, but it is critically important that we get money to replenish the trust fund at the unemployment insurance department. We spent hundreds of millions of dollars on those nearly 340,000 claims over the last 15 weeks or so. This is critically important. I know it's not sexy. I know it's not fun. I know it's not cool, but it's important. It's important if you have a small business. It's critically important if you don't want your taxes to go up. And it's also critically important if you are a consumer and you don't want your cost of goods to go up. So thank you all. Please be careful, and God bless.